In this video, we'll be going over fluid volume excess and overload by doing 5 questions. I will read the question for those listening, give you a second to think about what you know, then I will read the 4 options and we will discuss. This is just a surface overview. If you have further questions, please refer back to your nursing resources in the fluid and electrolyte chapters. Let's get started. Question number 1. An older adult is experiencing difficulty with fluid overload and edema. What nursing action would be the most accurate in evaluating the client's fluid balance? Is it number 1, evaluate vital signs every shift? Number 2, check for thirst in dry mucous membranes? Number 3, evaluate daily weight before breakfast every morning? Or number 4, assess client's input and output? The best answer is number 3. In this question, the topic was fluid balance, and it was asking the nurse what is the most accurate in evaluating. And daily weights are the best way to evaluate fluid balance. If you got stuck a little bit between that one and maybe the I and O answer, just remember I's and O's are used more to calculate and determine if interventions are working, like diuretics or replacement fluids, but not as an overall determination of fluid balance. Question number 2. A client has just received a unit of whole blood and is now receiving normal saline at 100 milliliters per hour. The client tells the nurse that she feels dizzy and has a headache. The nurse observes distended jugular veins when the client is in a semi-fowler position. What is the nurse's initial nursing action? Is it number 1, call the doctor? Number 2, assess skin turgor? Number 3, decrease IV fluid rate? Or number 4, continue all interventions as ordered? The answer here is number 3. So let's break this down a little bit. We should always focus on the complaints of the patient. She's dizzy, she has a headache, there's JVD, and she is receiving fluids. And then it's asking us our initial nursing action. That action word is implying, where are we in the process? Are we still collecting data, recognizing cues, assessing, or do we have enough data to start taking action, intervening? In this case, the thought should have been that you do have some proof of fluid overload. That headache and dizziness can indicate cerebral edema, water intoxication, overload. The JVD also confirms that. It's present while she's in the semi-fowler's position, which is the correct way to assess JVD. I would also like to know her blood pressure. However, that answer is not there, and therefore we're going to go ahead and intervene by decreasing the IV fluid rate. So a little side note here, don't stop yourself from picking an answer just because it might not say as ordered. They're not trying to be that tricky with you. If you see the answer that makes sense, pick it, because all answers imply that there is an order there. If you had a hard time with this question, make sure you review your assessments for fluid overload and remind yourself that JVD is assessed while at that semi-fowler 30 or 45 degree angle. Do not assess JVD while somebody's laying flat. We all might have some distension in our jugular vein if we're laying flat. That's not considered abnormal, and it's not a sign of fluid overload. So make sure to put your patients at semi-fowlers to assess that. Question number 3. A patient is started on a blood transfusion for a hematocrit of 22. The patient has a history of renal failure, anemia, congestive heart failure, and depression. The nurse knows that the priority nursing diagnosis is... Is it number 1, ineffective breathing pattern? Number 2, risk for fluid overload? Number 3, impaired cardiac perfusion? Or number 4, risk for injury? The answer here is number 2. Looking back at the question, the client is receiving a blood transfusion. That's the topic, and they have a history of heart failure. It's asking us what our priority nursing diagnosis. So in thinking about this, we remember that heart failure patients have trouble with too much fluid and are at risk for fluid overload, especially when receiving blood. And therefore, number 2 is your answer. Make sure you review those fluid overload signs and symptoms, and really remember that heart failure patients have problems with that. A lot of times that's what sends them to the hospital and their CHF exacerbations. One word also I want to mention on this one, please be careful with priority of just jumping down and picking the ABC answer. Number 1, which is the highest ABC answer, the breathing pattern, it has nothing to do with the question. So remember, you're going to get through these exams by critically thinking, making sure you understand the question and answering what they ask you, not by just kind of dropping down and picking ABC answers. Question number 4. An elderly female client calls the clinic and states she feels very weak and dizzy. Further assessment by the nurse indicates that the client self-administered an enema of 3 liters of tap water because she felt constipated. What is the most likely cause of the client's symptoms? Is it number 1, mucosal bleeding, number 2, sodium retention, number 3, fluid volume depletion, or number 4, water intoxication? The answer here is number 4. Looking back at the question, the patient's complaint is weak and dizzy. And we just had a question where he said that's a sign of water intoxication. And we know it's water intoxication because look at what she did. She gave herself 3 liters of tap water enema. That is a lot of water. And then it's asking us, what is most likely the cause? So without reading into this too much or implying that the enema worked so well that she got dehydrated, she just simply gave herself too much water. And these are signs of water intoxication. So we have to be careful not to read into questions, add other information. Sometimes it is straightforward. So if you had a hard time with this question, it's a good idea to review your water intoxication signs and symptoms so you can spot those easier. Question number 5. The nurse is taking care of a client with symptom of inappropriate antidiuretic hormone, known as SIADH. The nurse knows the increase of the ADH hormone will cause the patient to present with, and this is a select all that apply. Is it number 1, increased weight and pitting edema, number 2, dry mucous membranes, number 3, low blood pressure, and or number 4, low sodium level? The answers here are number 1 and 4. So if we look back at the question, the topic is the ADH. You have to remember that ADH holds water, and you can do that because there's an H on the end of that, and that can remind you H for H2O, holds water. And therefore, this client is going to be having signs of fluid overload. But you also have to remember, when water is increased, it dilates out sodium levels, causing a diluted hyponatremia. And one step further as well, you have to remember that sodium and potassium are opposites. So anytime you have low sodium, you'll have high potassium, because that could have also been in here as one of the answers. And as you're going through, the best way to attack this would have been to go true, false. 1 is true, sign of fluid overload. Numbers 2 and 3 are false. Low blood pressure is a sign of fluid deficit. And then, yes, number 4, we just talked about that. That is true. That happens when we have too much water. It causes our sodium levels to be diluted out. It would be like if you had a salty drink and you added more water, it would make it less salty, right? So it's a good idea to review ADH. ADH does influence water and fluid volume, and thereby also has an influence on sodium, which has an influence on potassium. So good idea to review that if you had a hard time with this question. That's it for fluid overload. Hope you enjoyed the content here and critically thinking through the questions. If you liked this video, please subscribe and don't forget to like our videos. And you can always find us at signstrategies.com.